And if you betray reality, you're betraying God, and he will not leave it unjudged.
Good morning and welcome to Chinook Podcast. We are gathered here today to interview Johan Bolton to discuss matters of hospitals and medical professions and stuff like that, and to work and pray for the work of the Holy Spirit to also move across the medical spectrum as well.
Mm-hmm. Right, so while we're sitting around the table here, there's Nathan Zechveld and Brad Donovan and myself, Jamie Souls, and with us is Johan Bolton. So we're what was your description a moment ago?
We're like four cats in a phone booth.
Like four cats in a phone booth. Here we are.
Yeah, today we don't have a phone-in interview. We have a live interview.
The best kind of interview.
Yes. So, and I brought a heavy book so we can do some book throwing. And
okay, that's all good.
All right, so we're going to each give a book review, and then we're going to ask Johan to share his favorite book with us as well.
Yeah.
Or at least his favorite one for today.
So, Jamie, you want to start?
I do, but I just need my portable memory open here. Yes, I have listened almost entirely through a book that I was recommended. I'm pretty sure I got it from Doug Wilson. It may have been somebody else who recommended this, by Abigail Schreier, called Bad Therapy. And it's talking about...
Bad therapy?
Yeah, well, yeah, and how prevalent it is to... have been listening through her section in schools where there's all kinds of things that go on that are really, really harmful for kids in conversation. Anyways, it's why the kids are not growing up, or why the kids are not getting it. I think that was the subtitle. But it's called Bad Therapy by Abigail Schreier, and it's quite the book. A lot of stuff going on in there, and she's quite insightful at recognizing some severe problems.
Yeah, my wife just finished reading that book, and also felt it was a very good book, and would highly recommend it.
Nice. Well, she could have written that book having talked to me.
Yes.
You need advice? Do push-ups. Okay, so my book recommendation for today is Future Men by Doug Wilson. It's a book about raising boys up into being men. It's a fantastic book. I think there's a lot of real good sound wisdom here. It's not too big, so you can get through it. But the opening line in the introduction is worth its weight in gold. And it goes as follows: as much as it may distress us, our boys are future men. So, when you're raising sons, sometimes it's good to have a book like this handy so that you can, you can be more intentional about some of the things that you do with your sons, and know what you should be thinking about for. Maybe not this stage of their life. Maybe they're in diapers now, but in 5 years they'll be running around and whacking everything that moves with a stick. And then 10 years after that, they're going to be ripping apart your car. So you need to know, ahead of time. Think about these things. Consider them. Mm-hmm. Yeah, it's a good book. I really enjoy it and recommend it.
Yeah, that's good. That sounds like a counterpart to the book that I recommended.
It does.
The positive end of... Yes. Well, what do you do?
Exactly.
What do you do in place of?
Linz and I have been very influenced by Doug Wilson, and his theology, as much as it's influenced us, we'll often say his parenting advice,
yes.
Him and Nancy's parenting advice has actually been the most helpful stuff we've got from them. And so,
yeah.
Mm-hmm. And we do have 4 boys that are past the diaper stage.
They're starting in on your car, are they?
Yeah, that's right. it. That's another story.
And I think if you talk to Doug Wilson himself, like we did on our recent podcast episode, he himself would. I think he sees his family, marriage, parenting material as kind of the epicenter of his work.
Yeah,
So,
very much so.
Yep.
Yeah.
All right, I've got a book that I'm recommending. It's entitled Larceny in the Heart, The Economics of Satan and the Inflationary State by Rousas J. Rushdoony. So I read this recently because I was writing an article on taxation for the Alberta Reformer.
Also recommend that. 10 out of 10. Go get it.
Yeah, you can find it on the Alberta Reformer. But yeah, anyway, this book by R.J. Rushdoony is... Well, basically, he walks through the problem of inflation. He talks about a number of the financial problems of our times, including high taxation. But these are all like an interweb of problems because we've got high inflation, but we've also got citizens who are taking on way too much debt. So we live in a debt culture, which feeds the inflationary culture, which feeds the debt culture again. And so... he just talks about this concept of larceny in the heart and envy and how that plays out in modern day economics. So anyway,
Excellent.
Rushdoony was such an insightful fellow when there was hardly any insightful fellows in the world. He was operating in the 50s, in the early 60s.
Yep.
There wasn't a whole lot of clear thinkers going on, but Rushdoony certainly was.
Yeah.
yeah.
Excellent.
Yeah.
We can circle back to that inflationary concept because I think in medical training there's a very similar kind of a process.
Oh, yes.
Okay.
Oh, ooh, shall we? Let's.
Yeah, let's get into
Well,
it.
Johan.
Johan's got a book review. He was
book
gonna
review.
mention a book to us, wasn't he?
Sure. Yeah. So the book I'd recommend everybody read. I think Jamie's already taken up this recommendation.
Yeah, it's a good one.
The Once and Future King by T.H. White, which is a fictional retelling, of course, of King Arthur, Merlin, and his training in the first book. The first book would be appropriate for pretty much any age, I believe. But then it's, I think, 5 books all I read one copied all jammed together, and it gets into the legend of Lancelot and Guinevere and the whole Round Table, all the knights, and his prose and his storytelling is whimsical. Very insightful. You can tell it's I know it greatly affected J.K. Rowling for Harry Potter. You can see a lot of influences.
Okay.
And she's written on the copy I have, and I don't know this, but I suspect it influenced. It was written in the 30s. I suspect it was influenced C.S. Lewis, and it really is a wonderful read. So
Yeah, I was just listening to that in the car on the way over, and I'm early in the book.
yeah.
And Wart is just meeting Merlin,
Wart is King Arthur. Yeah.
and it's the description of everything that's in Merlin's house.
Yeah.
Was just made me laugh out loud.
Yeah, Merlin is awesome in that book, and some of the because Wart's training and King Arthur even later is Merlin changes them into various animals to learn. So there's a very interesting kind of we learn from creation,
Right.
and so that there's a couple of them that are just so fun. Like the one that comes to mind is he describes this goose, and he goes to be with the geese to learn order, and order of society, because he's kind of had trouble with his round table. and in the course of this, he comes across a female goose, and his descriptions of her and her beauty and the plumage of her neck is just captivating. At the end of it, you're like, that's a good-looking goose, and her personality. And sure enough, King Arthur falls in love with this goose, and it's really sad when he has to stop being a goose because he has to leave her.
That's funny. All right, so
Yeah.
for anyone that doesn't know, Johan, you probably should just do a quick run through of your background
Sure.
and what it is that you do
Yep.
for your calling.
Yeah, sure. So I'm a general surgeon here in Grande Prairie, of course.
Have been so for coming on, I think this will be my 10th year or 9th year I'm in now.
And if people aren't familiar with where we are in Alberta, it affects my practice because we're kind of nestled quite a ways away from the next major center. So it means that I do a very broad general surgery practice. And yeah, that's basically it.
Okay. So when you say general surgery, you mean like injuries, repairing people that got busted up in a car crash?
Yeah, my quick way of putting it is that it's anything soft, gooey, and gross. So I don't deal with bones, and don't do open heart surgery unless it was from an accident and an immediate thing. And
interesting.
Yeah, don't do brains. Yeah.
Oh,
those would be soft, gooey, and gross. That'd be an exception to my.
To your general. Nice.
Yeah.
Okay, so when did you think to yourself, I want to do surgery? Like, when did this start?
Yeah, I didn't know. I don't have any a lot of doctors get influenced by a family member who's gone into medicine, but I don't have any. And my dad always thought I should be a doctor. Actually, he knew earlier on that would fit my giftings. But I was a fool and I didn't listen to my dad, and so I ended up doing engineering because my math teacher said I should do engineering. But I quickly realized on starting that was not what I started to get a picture of what it would look like for the rest of my life. I was like, I don't think this is me. And so I quickly pivoted, and I didn't know I wanted to be a surgeon, but I vividly remember the night that I realized I wanted to be a doctor. And it really was an odd inspiration of the Holy Spirit moment for me, because I was just pondering through how to witness to people and that didn't want to hear about God. And I thought, well, what type of person kind of has street credit with the average person? And so that idea kind of captivated me. I was like, if you can help somebody, they're probably more likely to be
listen. Okay.
Yeah. Yeah, and then so that kicked me down that pathway, and I didn't, since I didn't have any family members and I had no experience in it, I didn't know what type of doctor I wanted to be at all. It wasn't until into med school and my first kind of exposure to just a clinical experience that my first thought was I was going to work in the emergency, because that's what everybody kind of pictures doctors working in the emergency.
Right. Yeah.
And then I did that and realized, no, I'm really drawn to the procedural, hands-on stuff. And thankfully, a couple of the emerge docs that I was working with saw that and kind of nudged me into that direction.
Okay.
And sent me up. Actually, there's a famous orthopedic surgeon in town, Joe Senziak, who he's a cowboy kind of a fellow. Everybody's endeared to him in some way. Well, maybe not everybody, but he's a delightful guy too. But he, took me on, and we're putting in a plate into an ankle, and right away, as soon as these guys are like, "Oh, just go upstairs and work with Joe for a little bit," and then Anyway, I came home from my first kind of time in the operating theater, and I said I knew that residency for surgery is a whole other animal compared to the other ones. And so I had to break the news to Lindsay. I was like, "Oh, this is what I think I got to do."
So there's extra. So now doctors famously have a long training time.
Yep.
Like, it's not like if you're going to go be a carpenter where you can show up and an hour later you're carrying lumber.
Yeah, that's right. So the process, and just a brief overview, would be you got to get a degree. Most people have to get a degree to get accepted to med school. They take a small minority, maybe 10% or so, that don't have a degree. That they all have a couple of years of graduate studies and certain courses. And then after that, you get into med school, and almost all medical schools are 4 years, but there's a couple in Canada that are 3. There's at least one. I think there's another. And you just work through the summers, and they condense it down. And then residency to become a family doctor is a couple of years, and surgeons are 5 years, and I think there's a couple specialties that might be 4, but for the most part, it's 5-year residencies. And you can add masters and PhDs to that, so add another 4 years if you like. And then you can add fellowships on top of that. So, wow. And some guys get multi-fellowships by the time they get a job in a subspecialized center. So
Some of these people have been in school for forever.
Wow.
Yeah, I did it in 11 years. It took me 11 years, and I took the shortcuts. I did the 3 years in Calgary, and did my residency in Edmonton, and thankfully to work in Grande Prairie, I didn't need a fellowship or a master's or a PhD, and so I didn't do that.
Huh.
So how long have you been working in Grande Prairie then?
Coming on 10 years. Yeah.
Okay.
Yeah.
That is a lot of schooling.
Yeah. Yeah. But if for anybody hearing this that's maybe considering a career in medicine or for their kids, it is really a stepwise thing. And I never saw it as this long, daunting, like, it's just like, I tell this to my cancer patients, it's like, I'll give you guys this little spiel I give to my cancer patients. I was telling, it's like we've told them they have to climb Mount Everest. Right. And because I'm often the one breaking this kind of plan to them and giving them the quick overview of their whole next little bit. And it's complicated. There's a lot of steps, and it's going to take months, not just over next week. And, and the deer in the headlight thing. So similar to someone who's considering a career in medical school, you don't want to think of it like a dozen-year commitment.
Yeah, right.
You think, you know what, I just got to get into med school, and that's pretty much where the relief begins as well, because pretty much everybody that gets in finishes, unless you're a real screw up. You do get through.
It's a high bar to get in.
It's a high bar to get in, and then after that, we really want them, because we invest a lot of tax dollars in each student, actually.
Yeah. Well, it's like how do you eat an elephant, right? One bite at a time.
Yeah, exactly.
I'll sometimes even at my work, guys will be like, "Oh, we're going to be out here for 12 or 14 days. It's 30 below. How do we do it?" So what? You just have breakfast. Yeah. Okay, make it to lunch.
Yeah, that's right. Yeah.
When you get to lunch, supper. Make it to supper.
Yeah, that's right.
You did that. Now do that 14 times. It's not a big deal, is it?
Yeah, that's right.
Yeah.
So I wanted to ask you a question that was kind of formed, I guess, in one of our former interviews with Ted Fensky. In that interview with Ted Fensky, he talks about the doctoral practice being very similar to the pastoral practice. Have you seen that analogy? What does that look like in your practice?
Yeah, I think people are coming to you for help with something. And they know that there's a problem, however medical or spiritual it is. In fact, probably all medical problems are spiritual problems in a way, right?
Yeah.
And so they're coming to you for a problem, and you're the person to help them. So their guard is somewhat down. Now that is changing a little bit with our current climate coming out of COVID, and there's a lot of skepticism.
Right.
So those patients are maybe not as. But you would experience that too as a pastor. I imagine not everybody's coming in open to hear what you got to say. So,
yeah, well, I would say for the last 25 to 50 years, the pastoral practice has been under probably more skepticism than the medical practice.
Yeah.
So.
Yeah, that's right. Yeah.
Yeah.
So when you get somebody in the door, let's say I show up and it's a cancer or a big surgery.
Sure.
What's like? How do you go about? Because you're going to be the guy to break the bad news to me, but you're also coming with a plan. Like, what kind of? How do you when you walk in to consult with the patient? How do you do that? Like, what's?
Yeah, so this is a common thing for me because I do a lot of colonoscopies, and I'm the one to take out the colon cancer as well, and. So it's colored somewhat by the fact that when you finish a colonoscopy, you're still somewhat sedated.
Okay.
So I leave them as long as I kind of reasonably can in the recovery, and maybe I get their CT scan done or something for them. Get their family member that's going to pick them up in there, and then it's always a very humbling experience. You've got to. I pray before I walk in, and I'm like, God, be with me. And then I just try and be personable and calm, and their world really gets shoved, and they're looking for stability, and you can convey a lot of that just in the intangibles. It's not necessarily in what you say. It's
how you say it, and
it's just your presence. Yeah.
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 Okay.
And so you just try and try and portray confidence and calm, and tell them we'll get it figured out, and here's the next step, and
Nice.
and then I expect them to. I don't get into the details. Some people are really hungry for the details, and so you got to kind of quickly rifle through and feed that appetite for the details a bit. But that first encounter, famously, people know that you don't remember much of that.
Right.
So
Yeah, I can see that. I mean, you're half sedated in many cases.
yeah, and even if you're not, like for the breast cancer patients that we see, they're covering a lot of ground. They found out probably from their family doctor, but then they show up and they have no idea what's going to happen, and
Right.
maybe they've done some reading online, maybe they haven't done some reading online, and so they really you're downloading a lot of information, and you're trying to walk them through some tricky decisions. It's a real
Right.
relationship that it matters if you can strike up a working kind of like, well, you want to make it with your doctor. It's not a good idea to go into a doctor's office thinking, I'm going to make this decision. And you are the one to make
Yes.
the decision, but you surely haven't figured it out, all the nuances online.
Yeah. And there's nuance.
There's a lot of different
Yeah.
things going on. And so, yeah, if you can strike up like a nice conversational relationship with your doctor, it makes it a very pleasant thing. I really enjoy that aspect with my patients. And so,
Well, I one time read somebody, some bright spark that wrote that a mechanic, for example, works on the engine after it's off, but a doctor when it's on. And because I work with a lot of mechanics, right?
Yeah.
And one of the things that I've noticed is that some of the guys I work with like to be adversarial with the mechanic. Why didn't the idiot fix the thing, right? And I'm like, well, but how come he fixed it when I talked to him? Well, because we struck up a relationship. We can sit there and we can,
yeah.
and I can say to the guy, I know it's broken and I'm not entirely sure what.
Yeah.
But here's some of the symptoms.
Yeah.
And then we sit there and we discuss it, and then he diagnoses it and fixes it.
Yeah.
And meanwhile, my coworker over in the corner is like, well, that guy never fixes anything for me. I'm like, well.
That's right. Yeah, that's right.
Yeah.
Your joke is, so as general surgeons, I'd said earlier, we don't do open heart surgery unless somebody's in an accident. Well, we make the similar kind of joke at the heart surgeons, because when they operate on a heart, they get to put the patient on bypass, so the heart stops.
Oh, yeah.
But when I'm operating on a heart, it's not stopped. It's
Still going.
It's bucking away, and you're trying to, put some stitches in.
Yeah.
Yeah. And immediately when you sprung a leak.
Yeah.
Yeah. That's
So-
pretty wild.
Yeah, so one of the things I'm kind of interested in is something you've mentioned already, is that in the last 5 years or so, people are losing faith or trust, or maybe there's a growing skepticism in the medical system. Why do you think that is, and what do you think are some of the things that the medical system can do to remedy that?
Yeah, that's a big problem right now.
Yeah.
I think it's been a problem for a while growing. Like my kind of mentors throughout my training, you hear tales of their younger years as young doctors, and it really was a different world that they were in. And even the older folks that we treat now, they have a different way of looking at you than our generation even. And yeah, there's just like a trust that's eroded. And I mean, I think there's a ton of causes, all being spiritual, of course, but the growing kind of compromise of truth. I'm fascinated lately with the notion that God is reality, and if you betray reality, you're betraying God, and He will not leave it unjudged. He will not leave it without a consequence. And so, for instance, COVID, just since that's fresh in everyone's mind, and there'd be lots of examples of this, whether it's the abortion things, or whether it's euthanasia debate, or it's if you get back to the undergrad science level in general, like I just explained, this long history of education that I went through, or this long path of education. And the first thing, year one, I was having a biology teacher tell me that if I disagreed with evolution, I had to say it was from faith, that there was no scientific valid disagreement. And I was like, oh, I'm just a young, 18-year-old, and my prof's just like, calling everybody out in the room and putting you on the spot about it and everything. And so for a long time, academia has been at odds with God. And so, the more things that we betray about the way things are, truly, the system does suffer for it. And
especially in something so eminently practical as medicine.
Yeah, that's right.
Right, you're working with the way the body is, and you can't
unsee the you're given more information, right? It's like if you've seen the inner workings of a body, and yet you're still denying the existence of God, it says more about your soul.
Yep. Yeah, yeah. If you look at the intestine and think, how did that evolve? It didn't.
Yeah.
Huh. Well, I remember fairly recently I had a conversation with a coworker of mine about this kind of thing regarding evolution, and I made the statement that evolution is irrational and unscientific, and blew the guy's mind.
Yeah.
He still doesn't know what to make of me.
Yeah.
Yeah.
Yeah, I like to. So currently, I love to basically. I got this from Doug Wilson. The whole world is in disbelief of God, right? And they're actively suppressing God.
Yep.
And the image Doug Wilson uses for that is someone holding a beach ball underwater, and it's hard. It's hard work.
It is, yeah.
And so, I'm surrounded by all these people, and most, coworkers and various, staff that are around me intermittently, right? And I just go around and poke them in the ribs and say little things that I've been reading or whatever that may make them really question evolution, like the protein problem. And so,
Right. So what is the protein problem for those of us that don't know, like myself?
Okay. Yeah. The protein problem, my eldest son actually stumbled upon and shared it with me, and we got right into it. It's pretty fun. So the average for a protein to form, the place to start is that the simplest living organism has, I might get these numbers a little off, so fact check this for sure, but the simplest organism has 200-300 functional proteins in it. Okay. That's just like the simplest living thing. And each of those functional proteins has, at a conservative estimate, over 150 amino acids. And it's very mechanical, an amino acid, right? It's a shape that clicks onto another shape, and it forms like a molecular kind of shape, right?
Like a 3D living jigsaw puzzle.
Yeah, that's right.
Okay.
So of I think there's 21 amino acids. I could be wrong about that, but there's something like that for amino acids. And there's left and right-handed versions of all of them. And all of the living beings we know of all have only the one side. I forget if it's the left or the right.
Okay.
But so there's a 50-50 odd there that you got the right one.
Oh.
And then there's also two ways in which these amino acids can join. There's a molecular bond and there's a peptide bond. And it's 50-50. Again, when you put them side by side, which one it's going to be.
Okay.
So in order to get a single functional protein, you have to flip a coin 150 times to make this 150 chain to get all the right type of a bond. And you have to flip the coin 150 times in a row perfectly to get the right, all the left hand or the right hand side.
Whichever it needs to be.
Yeah.
Right. And that gets you one.
And that gets you one functional protein, but most people can't wrap their heads around what flipping a coin heads 150 times means.
Right.
It means that the coin is rigged.
It means so it's similar to painting all the atoms on Earth, just doing this the one time. It's similar to painting all the atoms on Earth blue, painting one red, and at random picking the red one.
Right.
That's getting the one.
That's getting the
And
one.
then if you add in the next 150 in a row,
Yes.
the odds of that is picking a molecule out of the universe,
Right.
a known universe.
Yeah, because you have to multiply.
There's so many zeros, and so it's outside of our human mind. So it's
Right.
helpful to be like, okay, well, I could picture, or you have to pick it twice. You have to pick that red molecule once on Earth, and then you get another shot, and you got to pick it again.
Right.
And it's just
And that's two.
It's impossible.
That's two molecules, and when you think about how much protein a beefsteak has, that's a lot more than two molecules.
Yeah, it's math. Like any mathematician, I think this is why mathematicians are kind of, even secular mathematicians are moving away from evolution, because there's like they can wrap their head around that many zeros and just be like, nope.
Yeah. Nope. Huh. That's funny. Okay,
That's
so
interesting.
that is very interesting. I had not heard this problem
Yeah,
before.
so
but this is
try
a good
unpacking
problem.
that to an operating theater full of educateds that have never questioned their
Their
worldview, and they're like,
So how many of these proteins do you think this patient on the table has? That was an awful lot of crazy random happenstance.
yeah,
Huh. Interesting. That's fun.
yeah.
That's fun. So when like over the course of your practice, how many people do you think that you've run into would be like, what percentage of people would be Christians, and what percentage of those Christians do you think are orthodox on things like creation, roughly?
I don't know. I don't really know. I often do get pleasantly surprised to find out that somebody is a Christian. One of the other problems with the medical world is that we haven't. We've made it such that it's kind of not okay to talk about your faith out in the open, right?
Oh,
Like the whole notion of like, well, don't share your faith with your patient. That would be bad. It took me a while to kind of get past that,
Right.
and to figure out, no, it's actually totally fine, and people appreciate you being a full person with them,
Right. Yeah.
And so for that reason, because it got religion and believing things got set way off to the side in academia, it's not something that professionals will bring up very readily with each other, even if they're both Christians. You kind of have to, pick up by some clue.
Right.
In my own life, thankfully, God was gracious to Lindsay and I, and put a strong Catholic right next to me at the start of med school in my locker, and he immediately intuited that I was Christian, and likewise, and so we found a third right away, and the three of us, marched through medical school together with
Excellent.
Oh, good.
with some support, and that was nice. So
Yeah.
yeah.
That's excellent. Now, with because we started this with trust. Now, trust in institutions right across society has gone down, I would say.
Yeah, there's been an awful lot of reason for that.
for it. Yeah, I certainly do not trust our institutions much. I mean, if you read my Substack account, you'd see that. So when you've got somebody that's coming at you from a low trust background, do you handle them a little bit differently than somebody coming from a high trust? Do you take a different path?
Yeah, for sure. It takes a lot of the low trust person takes a lot of patience. So I recalibrate my expectations right away, and I'm like, okay, I'm gonna have to spend some time,
Right.
and it's tough. You're walking. I think a lot of doctors might write those people off right away, and they may not even get a fair shot at changing their mind. But I have changed some minds.
Yeah.
Actually, there's old farmer I'm thinking of who had colon cancer. He was just not going to remove it. He had someone who'd had a bad experience, and I was telling him he had colon cancer, and he was just like, nope, I don't want anything to do with the medical world at all. And I was like, okay. So I explained it to him once, and he's like, okay, I'm pretty sure I'm not going to do it though. And I said, well, you should bring your wife to the next visit, and we'll have another visit. And a lot of folks would write someone off like that because they're just like, okay, it's a wing nut, and on you go, and I want to help the people who want help.
Yeah.
But at that second visit, I was able to explain. I was like, I just broke it down, real basic logical things like, if you were in Vegas, your chances of getting this cured would be this much. You'd be playing those odds.
Right.
And just kind of again and again put images of like, this is what this means. Mm-hmm. Let's just look at the big facts we can say about it. Mm-hmm. And got him through, and he was out of the hospital in 3 days after his surgery, and never looked back. And
he was probably back on the combine within a week.
Yeah.
These old farmers.
Yeah. So you kind of have to be gracious towards somebody that's accepted a lie or is wrong about something, and then there's not everyone is convinced. There's lots that sadly leave. And just this week, I was imploring somebody to do the right thing, just like this, and I was like, don't. I implore you, I said.
Yeah.
So you just try your hardest and do what you can, and God's in control.
Yeah. One thing too, like I noticed that many critics of the work I do have no idea what it is. Mm-hmm. Right. So can't tell a drilling rig from a frac string.
Yeah.
Which is pretty basic stuff. So if because one of the things I've seen a lot is like complaints about like big pharma,
sure,
and that kind of thing, the procurement of various drugs and how that's bought and sold. But then I look at like surgery where you're cutting a cancer off of a guy.
It's a little harder to fake.
It is. So I'm just wondering, when somebody comes to you and they're complaining about some other branch of medicine that might be peripherally related to what you're doing.
Yeah.
Like, what do you do with that? Do you just like throw the coworker under the bus, or? That's what I'd do. I mean, that ain't me. That's that guy.
I've been made humble enough to know when I'm wrong. Like I know that I have learned things over the course of my career that I was wrong about, and that I thought something was a certain way, and I've had my mind changed.
Yeah.
So I'm comfortable when a patient comes to me and has some total quackery solution to something they want to try. I'm very comfortable being like, I don't know.
Right.
I don't know if this will work or not. I don't think, I'll tell them I don't think so.
Right.
I'll give you my opinion. I don't think that's going to do anything. And I'll just tell it right up.
Yeah.
But I think the fact that I just don't completely write them off, it helps them to be like, oh, okay, well, this guy's not just stereotyping all of my thoughts and,
Yeah. Yeah, you're an idiot. I know what I'm talking about. Shut up. It's not that.
Yeah. You don't need to butt heads with them like that, especially like you just said, to get them through the big picture thing of like, well, first let's do this surgery to fix you.
Yeah.
And it's usually if people have had time to think, like if someone's in emergency and they're in extreme pain, it's not much convincing to get you to the operating room.
Yeah. Yeah. It's very immediate.
Yeah.
Yeah. Interesting.
Yeah.
I want to bring up a different sort of a thing. In recent times, since I think probably since Donald Trump got elected down in the States, and he spoke about Canada being the 51st state, and so many Canadians are just their hair's on fire over these sorts of things, and almost invariably when people rise up to defend Canada, the first place they go is look at our medical system. Mm-hmm. That's the first place they go. But I look at our medical system and I see that if I want to get a hold of my family doctor, mm-hmm. It's very likely 3 weeks before I can get in to see him.
Yeah.
And that's just for whatever. I might have a really
Like
nasty
achy joints or something.
or a nasty cold that's overrunning me. I can't get in to see the doctor.
Yeah.
Yeah.
But if you get into a car crash, you can get in to see Johan pretty quick.
Yeah, if I have some kind of a major disaster,
Yeah.
that's okay.
Yeah.
But
yeah.
if I'm
Yeah.
Mike Donovan
Yeah.
and I'm waiting for
A family doctor forever.
surgery on my eyes,
Cataract
or I'm
surgery,
waiting
yeah.
for
Yeah.
I'm waiting forever. Yeah. And I look at I got two instances just recently from people who had emergency surgical medical issues in other countries that just got dealt with. Bang, they were dealt with.
Yeah.
They're in Thailand. They go into the hospital. It's 5 minutes before they get to see the doctor, and they're all dealt with in like an hour, and then they're back out.
And that does happen.
Can you talk to that?
Yeah, so that does happen here still as well.
Okay.
There's a lot of patients who get great care, but it's kind of like that the news cycle thing on the Boeing 747 where the door fell off. Our healthcare system is much more complicated than a Boeing 747.
Which is pretty complicated.
It's pretty complicated.
Yeah.
So you want to, if you're at the front of the plane if you're at the back of the plane, the door falls off and you might be okay. But if you get unlucky and you walk in the door and you encounter the section that's falling apart, or then you're not going to be okay.
Right.
And so you may or may not get good health care.
Mm-hmm.
It's kind of it's a real mixed bag at the moment. The wheels are falling off, and then it's not that the thing is completely crashed. It's just in the convulsions of dying, and needs to be redeemed and made new again. And the socialist idea of public health care needs to go away. I'm a believer that the family is entrusted in sphere sovereignty with the well-being of its people.
Yeah.
First and foremost, and that married with the concept of just straight up the middle capitalism, which I believe all good Christians should be capitalist.
Yes, agreed.
But those two things together, if you look at it in relation to medicine, you got breaks all of a sudden on spending, because the amount of money we're spending on healthcare is just going up and up and up and up. And I mentioned my old mentors, in the nicer days of when they, as far as like the patient's trust in them back in the old day. But the other thing that is very different for when I came through and for when these old boys came through was that they only had like a handful of medications to learn. Like there just wasn't as many things to learn. We just didn't know. And, and the studies that backed up various things were just less. And now, like if you go on PubMed or Medline and you start looking at the studies on any one topic, I'd encourage your listeners and each of you to just try that. Go on there and just look. You can't look at the studies, but anybody can go on there and just try and do a search on some topic,
right,
and see how much comes out of there.
Right, it's quite a bit.
Because there's way, way, way more knowledge. There's way, way, way more medicine, as you're saying, than there was.
That's right.
50 or 60 years ago.
That's right. So and then back to my kind of stream of thought about, we need breaks on the system is you need somebody connected to that decision-making model of like, okay, there's a benefit to this, but it's not always black and white. There's a lot of things that we would decide to do that might give you 5% chance better that this cancer doesn't come back in the next 5 years.
Right.
And ironically, the drugs that have that very marginal benefit, they cost a lot to prove.
So the cost is higher for a marginal benefit.
Because you have to do a really big study to show significant difference.
Right.
And that gets very, very expensive. And then that company needs to recoup that. And so then they have to charge a lot for that drug.
Right. And so you have an inflation in cost.
Yeah.
And then they also need you to use the drug.
Yeah, that's right. So actually, the Canada-U.S. thing is layered. There's a lot of things about the U.S. system that I like. But for instance, the drug bevacizumab is a monoclonal antibody drug, which they added in for adjuvant therapy for colon cancer. Mm-hmm. And it's one of those drugs. It gives you a marginal benefit in a select group of colon cancer patients, actually quite a small portion. And but it was, when it came out, it was like the new thing on the block, and it cost a lot of money. And because the Canadian doctors weren't as they're not being driven by the patient's needs entirely. Like in the States, they don't have breaks either because their insurance companies don't have breaks.
Right.
Yeah, I've noticed that.
Yeah. They actually have their foot locked on the gas pedal.
It's one problem for another.
For the spending wise, the insurance company wants to spend. The more it costs, the better.
Yes.
And so this is where the whole sphere sovereignty thing with family becomes really important, because if my dad gets colon cancer, we're going to be having a chat about whether or not this bevacizumab is worth it.
Yep.
5%, and this is if it's coming out of our pockets,
right?
It matters.
Yes.
Now, so I do think we have to recoup some version of that where there's some breaks on the system. Mm-hmm. To get there, I don't think our society is ready to jump right to
to responsibility.
Right to responsibility. I don't think kids are ready to have these hard chats with their parents, and it wouldn't go well. Yeah. But I do think that there's a good bridge model. I like we talked briefly about the insurance versus the public model. Mm-hmm. I think there's an in-between to get us where we want to go, something like what the farmers did with co-ops.
Oh.
And so I think if you can form an insurance model where you're accountable to your peoples and limit the size of it. So that, so say
like regionally limited, maybe
regional, you could have it for, certain cultural groups. Like you could have a ton of these co-ops pop up, and you would give them a general framework for structuring what it was, and you'd cap the size.
Right.
Because the crony capitalist, the mega company, is a problem, right? Yep. And they have a lot of influence, and they can steer the spending to be more and more. That's what's going on in the States. Yep. And so if you can just cost share your healthcare benefits with even 1,000 people, all 1,000 of you aren't going to get sick at once.
This is true.
And then there's some accountability, because you can probably, if it's just 1,000, you can probably call up the people on the list. Yep. And say, are you taking us for a ride? How come you're still disabled? Mm-hmm. And somebody will know if it's real.
Yeah. Yeah, you're going to have less fraud.
You're going to have less fraud. And there's systems like that going on already, I believe, in the States.
Okay. Yeah. There's one that I heard about. I forget the name of it now.
Is it Samaritan's?
Yes, Samaritan's Purse. Yeah. That was the one. Yeah. Yeah. So that is what that is.
Yeah, that's right.
Well, that's what Samaritan's Purse is doing.
Yes.
Yeah.
Oh, okay.
Yeah.
Interesting.
Yeah, they're an insurance co-op.
I remember the early 2000s sometime. I was down in the southern states. I was in Louisiana. I was doing a concert at a church, and I was staying in the home of a young pastor and his young wife. And I remember our conversation that evening, in which they were really feeling the pressure of, we really want to have another child, but it's so expensive to go to the hospital in Louisiana. It was terrible. And so they were trying to balance their books in order to get to where they could possibly afford to have a child. And I remember thinking about that with regards to home. I had 8 kids. I got 8 kids, and the thought never crossed my mind that
these things were expensive after they were born.
Yeah. And it did lower my complaint level about the Canadian system when I was dealing with that. I remember that.
Yeah. Yeah, but if you can take that insurance company's foot off the gas pedal that hyperinflates the cost of everything,
Yeah.
then all of a sudden maybe it doesn't cost quite like it's going to cost something, but it's not going to be as astronomical as what they're experiencing.
Yeah.
Yeah.
I ended up getting somewhat connected with the guys that are starting the Veritas surgery group down in Moscow, and they were the ones, the founder guys were explaining this to me in that the cost of taking out a gallbladder, so that's something I'm very familiar with. In the States, it runs, at most hospitals, around the $20,000, maybe $15,000 on the low side, and maybe mid-20s depending on where you end up. And these guys were able to come up with a model that, this is the whole Veritas surgery group is premised on the fact that they're not doing it through the insurance model. They're doing it through these co-ops or outside, like just the private payer comes in and just offers the money. Okay. And they're able to take out a gallbladder, paying the doctors 150% of what they would normally make, and renting the space from their local hospital at a premium such that the local hospital wants to rent it. So they can take all the pieces that are existing. They're not making anything new. And they're able to do it for $6,000 to $7,000.
Oh, wow.
And so, and make a profit themselves. Like they're still making a profit.
Like they're making good on this.
Yeah. And
That's
so
less than
it
half.
just shows how powerful the insurance company's foot on the gas has been.
Yeah.
Yeah.
And the way I'll briefly explain for the listeners what that looks like. So when Obamacare came in, they made a rule, something to the effect of the insurance company had to pay out, 80%. Okay. So it basically fixed the profit margin for these massive capitalist companies. But the only way, so if you fix the profit margin on a massive company, the only way for them to make more money is to do more volume.
Scale. Yep.
And so if you increase the price of a hospital visit by double, now your 20% is really 40% what it was before.
Right.
And so quickly, the control over the spending that's going on in the hospitals just went through the roof. And so that's where we find ourselves down there.
Yeah. So in Canadian terms, though, where's the inflation in the cost? Because I know that there's part of it is our dollar, but part of it's also because it's taxpayer funded.
There's a healthy amount of more than a healthy amount of government shenanigans,
Right.
and just like. Yeah, like if you want something run well, don't trust the government to do it.
Yeah.
Like it's just so horribly inefficient.
Unaccountable bureaucrats.
Yeah, just levels of administration that are just unprecedented and growing all the time. And so,
Oh, Doge, come north.
Yeah, we need some Elon Musk.
We're going to have to get Danielle Smith to hire Elon.
He's still got a passport, so it shouldn't be that hard.
Yeah. Unless that petition to revoke his citizenship worked.
Oh, it better not. I like that guy's internet. I mean, come on. Yeah. So because there's like layers and layers of bureaucrats, and the one thing that a bureaucrat will always do is make sure that his job continues.
Yeah.
So those levels of bureaucrats, that comes all the way from like top administration to procurement to like everything.
Everything you can possibly think of.
Right.
Yeah.
So that's how come I have to fill out so much paperwork when I go in for something.
Yeah. I remember hearing a story in residency that there's a new consent form that was being released into AHS, and one of the surgeons in Edmonton was held it up to everybody, and he's every doctor gets somewhat involved in these administrative roles, right? And as I am too. And so, but he had somehow in his meetings had come across this because there's in Alberta we have a dyad model, so you've got an admin person coupled with a physician, but problematic for a bunch of reasons. But anyway, in that model, this guy had seen this administrator of sorts at one of these meetings, proudly announce that he had finished this consent form. And it was just being tweaked. It wasn't like out of nowhere. It wasn't the first consent form ever. And it had taken him 3 months.
Oh my!
And it's like, okay, well, for 3 months you've been tweaking this piece of paper.
That I could have tweaked in 3 minutes.
Yeah, that's right.
Oh my!
Wow.
Now that guy collected wages for that 3 months.
Oh yeah.
Oh yeah, he billed for that. Yeah. Huh, man. So what you're saying then is, if I want real job security, I need to work for the government.
Yeah.
Oh, that's terrible.
Yeah, get your nursing degree.
Right. Well, my bedside manner is pretty rough. I mean,
I would not want Brad to be my nurse.
I would not want me to be my nurse either. I'd be like,
Yeah, so I mean, the nurses' union is a problem, right?
yeah.
It's even another level of organized socialism on top of it all, right?
Right.
So it doesn't matter if you're a bad nurse if you're in the nurses' union.
Oh, so I could be your nurse.
Yeah.
I don't know if they'd let me in. They probably wouldn't.
No.
No, you'd have to shave your mustache. They wouldn't allow that, I don't think.
Oh, wow. I don't know. It's more like what comes out of my mouth rather than what's, ordaining the top of it. Or,
Yes.
Yeah.
yeah.
So what I see here is a system of thinking about healthcare that is that kind of pushes back again for rehumanizing the people walking in through the doors. So your doctor is not just a face or a robot that you hardly know, but somebody that you actually get to know, you're actually able to talk to. The people walking into the hospitals are not just numbers. And then we're also pushing in a direction away from this socialized bureaucratic system towards something that has more reasonable costs, is not so wasteful in spending. I think there's lots of good ideas in here.
Funnily enough, the whole socialist healthcare model sells itself as being this people-loving,
Human.
Yeah.
Very like the communist pushback. Because I'll share these ideas with the doctors I work with, and the communist pushback I get is you're heartless. Like you wanna just like not give healthcare to people, and I'm like, well, no, actually,
I'd like to give good health care to people cheaper.
yeah, that's right. And the way I've explained it to them is, if we are propping up all of these people that can't afford their health care, and we're taking tax dollars to do that. What we're actually encouraging is, because those tax dollars aren't your dollars, and if you in my model, there would still be people who wouldn't end up in these co-ops, and they would need health care, or something would go wrong and they would need help. But rather than trust the government to organize some kind of system to care for those people, if people really do care, if our neighbors really do care about each other enough that they're willing to spend our money on this, then let's set up charities. And then it's somebody who actually does care about that people group. And so it's not that the person could go completely uncared for. It's that, well, you're not going to be stealing money from somebody through tax to pay for it. You're going to actually be connecting the person paying and caring to that patient. And that's a much healthier societal.
It's more human.
Yeah.
Yeah, so one of the things I'm kind of thinking too is I know with a lot of lawyers from time to time they do pro bono work.
Sure.
I wonder if it would be possible for doctors to do pro bono work within a capitalist system from time to time.
Yeah, for sure there would be.
Mm-hmm. Now, it's funny that one of the common complaints, is that, well, if you want to change the system away from socialism, you clearly don't care about people. But many of these people are actively involved in or supporting abortion or MAID.
Sure, yeah.
And I'm like, well, but that's not pro-human flourishing either. But that's definitely state-supported.
Yeah.
And I think to myself, I think MAID, for example, it was going to be it was going to be rare. It was going to be safe.
That's what they said about abortion long ago.
Yeah, rare, safe, and only in case of need. And I'm like, but it's the number 5 killer of Canadians right now. It's number 5.
Yeah.
And I think it was actually sold as a cost-cutting measure.
No, it is, and it's a huge societal cop-out to not fix our issues because they've surveyed Canadians not long ago and found that like 25% of Canadians are in favor of euthanasia for us as a potential solution for homelessness. Which is like, well, if we care about this person, how about we provide some housing?
Or something other than a knife
death.
to the throat. Yeah.
Right? Then 50% for,
I love you, therefore I must kill you.
50% for mental health issues. And it's like, well, what about helping them with their mental, like we have a huge barrier to accessing mental health, just straight up the middle, what we're doing now.
Yep.
Not everyone can get it.
Yeah.
How about we address that rather than make, the KCL more available?
Yeah. No, I look at that and I'm like, I thought we were about helping people, and I'm all for helping.
Yeah.
But just, offing people because they're inconvenient.
Yeah.
I mean, at root,
Yeah.
everyone in this world is inconvenient to me.
Oh yeah, for sure.
Like if I'm going to go that path.
Yeah. And then put yourself in the shoes of a surgeon who's about to embark on a huge, challenged, complicated fix to some disaster that's unfolding in someone's body, whether it's a cancer or it's, sepsis from your bowels dying.
Right.
And you're old or maybe you're even not that old, but you're just, the chances of you coming through are starting to dwindle. But rather than do all those long surgeries and all of the, that months in the hospital that it's going to take, it would be easy.
Here's a drug.
We could do this route.
Yeah.
And
That's chilling.
yeah, it's really.
Yeah, it is.
Yeah. Well, I mean, we know some people that got the letter from the government because of broken legs.
Yeah.
Yeah.
So there's to circle back to my career choice thing a little bit, there's a healthy amount of it that's just about doing the hard work.
Right.
It is, for anyone considering becoming a surgeon, it's a lot of hard work. And you have to start to like that, and you have to make sure you continue to like it.
Right.
And that is a very good way of serving people and the Lord.
It's a calling, not just a job.
Yeah.
I mean, I could just take another job.
That's right.
But if you're a surgeon, like, you're not just going to walk away from all of that. You can't be that kind of, you can't have that kind of mindset.
No, I'm pot committed. Yeah.
Excellent. All in.
Yeah, yeah.
Ride or die.
Yeah.
I like that.
All right. I think we probably should start wrapping up now.
Yeah, we're at about an hour.
Unless
Yeah.
we have more. But
Yeah, I think that would be good.
Yeah.
Johan, we're very thankful that you've taken the time to come and sit with us and have a chat.
It was a pleasure.
It does interest us very much here on the Chinook podcast to be able to talk to people who are good at what they do, to talk to people who are invested in what they do, because we know that the advance of the kingdom of Christ, the advance of the cause of our Lord Jesus, covers the whole spectrum. It's not just the preacher's job. It's not just the elder's job.
Yeah.
There's something about the pursuit of good work that is glorifying to God. And we're quite aware of that, and so we want to be able to interview folk who are doing good work. And so we did think of you, Johan, and thought, this would really be a good conversation. So thanks very much for coming and joining us on it. Yeah, it's been a delight. So we are the Chinook Podcast. We are operating here in northern Alberta, and we are hopeful that the Lord will move by his Spirit and bring many, many people to a knowledge of Christ, that he would move like a Chinook wind through northern Alberta, through western Canada, and win lots of people. So you could pray that with us as well. We would encourage you to do so, and it's been a delight to talk with you.